Welcome to Adapting Class. Today we will be talking about nursing process and critical thinking, answering questions using these processes that you already know. So let's get to it. This is the first question. Very straightforward question, prioritization as usual. Now we'll read it. I'll try and see if you can put down your answer, your comment in the comment section, and then I'll answer it. I give you 10 seconds or 20 seconds. The nurse is caring for the following 4 clients. So think about it as we read through. Who should the nurse see first? Right. Prioritization. Whatever strategy that you have, I call it, you got to be sharp. Pay attention to things that is going to kill the patient. You have 1 second. 1 hour post cholecystectomy with 100 ml of serous drainage. DVT on heparin now reporting dyspnea and chest pain. Pancreatitis rating the abdominal pain 9 out of 10. A scheduled patient who's scheduled for discharge in needing what? Insulin injection education. Who do you want to see? And put on your answer. Let's think about it. Prioritization 101. I always say just divide the question into 2. Look at the scenario and what is happening. You have to be sharp. And things that will kill the patient is what be sharp is all about. Right. What do you think? You put down your answer? Let me take a look at it, and then we can proceed. But this is a common question that you see, is a setup to just introduce you to the lecture and think about what you need to do. But this is prioritization 101. I know you know it because you watch Adapting Class. What is the right answer? Post-op cholecystectomy and 100 ml serous sanguinous. Should that concern you? Should you worry about it? DVT on heparin reporting dyspnea and chest pain. What do you think? And then pancreatitis, the pain is 9 out of 10. And the patient is scheduled for discharge, you need an insulin injection teaching. Right. I said you got to be sharp. So who do you think you want to deal with first? Cholecystitis, had a cholecystectomy, now 100 ml. And I give you serous sanguinous is not bleeding. Therefore, I know this is not a bleeding problem. I'm on heparin, I have DVT, right? And I have dyspnea. This is a pulmonary embolism right there. I have pancreatitis. I expect to have an abdominal pain. My abdominal pain is 9 out of 10. That's not a problem. It's not going to kill me, right? I'm scheduled for discharge. I have time. So the nurse have time for the last patient. The patient with pancreatitis, what? You're supposed to have pain. 9 out of 10 pain. There's no evidence of peritonitis. Therefore, even though they have 9 out of 10 pain, you should not worry about it. 100 ml of serous sanguinous. There's some drainage, but I use the word serous sanguinous. If they wanted to worry about blood, they will put blood there. It's a serous sanguinous. It's not bleeding, so don't pick it. Even though it's 100 ml, ignore it. The number 2 is the right answer. We have a PE patient. He's going to be in trouble. This is nursing process, critical thinking with prioritization. So 2 is your right answer. Same thing. What is the next best action? What should the nurse do, right? This is ethical dilemma nurses will face sometimes, but you have to master your ethical teaching and ethical and law associated with this, like legality and ethical. I did a video yesterday. You can watch it. It tells you about all this. When you watch that video, you'll be able to answer this question. A client with what? End-stage ALS, right? Amyloid sclerosis. Tells the nurse that he has what? Signed a DNR, do not resuscitate order, but his daughter is demanding a full code measures, right? The daughter is requesting something that against the patient wish. Patient has signed a DNR. What is the next best action? Think about it. 30 seconds. Put down your answer, right? Follow the daughter's request since she's the next of kin, right? 2, follow the client's DNR order and notify the air care team. Ignore the conflict and wait for the provider to arrive. Cancel the DNR order until further clarification is obtained. 10 seconds, 20 seconds, 30 seconds. What do you think? What should be the right answer? You can put down your answer. I give you a few seconds to think about it, but you know the key. Patient said what? DNR, I don't want it. This is what I signed in my DNR. The daughter want full code. Who do you listen to in this ethical dilemma? If you watch that video, I talk about autonomy and client autonomy have precedence over what the daughter wants. So you follow the client autonomy, ASIADH. So whatever it indicated in the do not resuscitate, that will be what we're going to follow. Therefore, what do? Put down your answer. If you know, if you can put down your answer and put down your comment. But the daughter request, since she's the next of kin, does not trump client autonomy. Follow the client DNR order and notify the air care provider. It sounds reasonable. Ignore the conflict and wait for the provider. You can take care of this. You know ethical dilemma, so you should be able to answer this. Cancel the DNR order until further clarification. There is no clarification. Patient said, I don't want it. This is what I want in my DNR. So therefore, number 2 is the right answer. We should follow the client's request. What is the next best action? This question is tricky. I want you to think about it carefully. It's design, it's all nursing process. These are the things that happen in terms of the nursing process. And you know the process is a critical thinking when it comes to nursing process. What is the best next action? A nurse administered 10 units of regular insulin instead of 5 units as prescribed. The client is currently alert with a glucose of 88 bars rate. I said, when you answer question, go for the bars rate. Wait, rewrite the question your own. What does the question say? Critical thinking. Like I said, stop and then don't answer the question. I give a patient 10 units of regular insulin instead of what? 5 units. That means I made a mistake. But the client glucose is what? 88. What do? Notify the provider and monitor client and glucose. Give the client orange juice immediately, right? Fill out an incident report and document the error in the chat. Wait for symptoms of hypoglycemia to occur before intervening. What do you think? I give you 10 seconds on this one. Do you notify the provider and monitor the client sugar? If you know, put down your answer. Give the client orange juice immediately. Fill out an incident report and document the error in the chat. Wait for symptoms of hypoglycemia to occur before intervening. Nursing process, critical thinking. These are questions to let you think, but at the same time, you have to use a B sharp. What is the preference and what is the protocol when a patient, you do something like that? Remember, the content here is whenever there's a medication error, there's the way you proceed. You assess the patient first, you notify the healthcare provider, you monitor the client closely, you file incident report, and then you chat in the actual record. One thing you should know, you should never document errors in the client chat. Errors are supposed to be done in incident report. Those are confidential. It protects you. It does not protect. The chat does not protect you. Whatever you put in the chat is visible to the patient because he can request for it and the patient lawyer. But if you file incident report, it's secret to the hospital, it's confidential, it goes to risk management. These are things, little things you see on the NCLEX. Incident report is not visible to the patient. You go to the risk management and protect the hospital and you in case you get into trouble. Whenever there is a documentation, you did anything error, you don't document as an error. You document as what happened. That's the fact. You say, I give the patient 10 units of insulin at 8 o'clock. Patient vital is this. HCP is notified. That's all. This is what he did. You don't say, I give him 10 instead of 5. That go into incident report. So for this one, you notify the provider and monitor the glucose. You should not give them insulin, orange juice, because the glucose is 88. There's no need for that. Filing incident report is okay, but documenting the error in the chat is wrong. You should not do that. Waiting for symptoms for hypoglycemia to occur is bad. The number one thing you do in a medication error, assess the patient. So this one, A is the right answer. Notify the provider because he may give you more orders. You can monitor the patient. A nurse is caring for a client newly diagnosed with heart failure. The client is short of breath, has bilateral crackles and autopnea, right? This is consistent with the heart failure, right? Consistent with the heart failure. Which action best reflect implementation phase of the nursing process? It's a straightforward question. It's a bunch of words in it, but this is key, right? You always, when you see a nursing process question, follow what they ask you. Which of these answers indicate that I'm implementing something? Place the client in a high follow position and apply oxygen. Auscultate lungs and monitor intake and output. Note worsening crackles and notify what? The provider. Set the goal to improve respiratory status within 24 hours. You know the nursing process. Which of these I'm implementing? I'm doing something. You can put on your answer comment, but implementation means I'm doing something to solve something. So I'm going to do something to solve something, right? Action works. Setting a goal does not look like you implementing something. It's for the future, right? That is the problem. Note worsening crackles and notifying what the provider you're evaluating, right? Right. And then assessment, you listen to the patient long and you monitor intake and output. That's an assessment. You are not implementing. Place the client in a high follow position because the patient had heart failure and has crackles in their lung. You're doing something to solve their problem. So this is an implementation. Number one is an implementation. These are little things you may see. You just have to follow the words and then what you know. This is the critical thinking using your content to answer the question. A nurse is caring for a patient with SIADH. Buzzword. That's all. Single, straightforward words. Which of the following intervention are appropriate, right? What do you think? Select or apply. Restrict fluid to 800. Encourage oral free water intake. Monitor for signs of what? Hyponatremia. Administer 0.45 normal saline. Seizure precaution. Monitor weekly weight. This is a critical thinking question. It requires some knowledge, content, is endocrine, but you can answer it. The first thing you do, go for the buzzwords. I said, this is how you answer question. I focus on it. I said, SIDH. What do I know? I have too much ADH. If I have too much ADH, then I'm going to hold on to water. If I hold on to water, well, I have what? Fluid overloaded. If fluid overloaded, that means I have too much fluid. No matter what, I'm going to have dilutional hyponatremia. This is the content associated with that. You done. What the statement I made is what you're going to use to answer the question. Don't jump and answer the question. Fluid overloaded and dilutional hyponatremia. That means I have too much fluid. I'll write it here. And my sodium is low. This is what I should expect in what? SIDH. Therefore, what would I do? Restrict fluid. Oh, I have too much fluid. I'm going to restrict it. Encourage oral fluid intake where I have too much fluid. You're not going to do that. You see, monitor for signs of hyponatremia. I told you sodium is low, so this is good. Administer 0.45%. The sodium is already low. Hyponatremia, you don't give them any more hyponatremic fluid. You don't give them hypotonic fluid. If you need help, fluid and management is not that difficult. I have a bunch of videos that talk about easy way to remember them, not memorizing. But if you have hyponatremia, you should not give them any hypotonic fluid. This fluid is hypotonic. It's not getting it. Seizure precaution, because I'm going to have hyponatremia. Monitor weekly weight. That's wrong. You should not monitor. Even though it's a monitor and weight, you got to look at the whole totality of the answer trace. It should be daily, not weekly. So this should go wrong. So number 1 is the right answer. Number 3 is the right answer. And number 5. So 135 It's a select or apply. New generation NCLEX, right? Next generation. You pick those that you 100% confident, because if you over-select, you're going to lose point. There's 3 answer choice there. If you select more than 3, you're not going to get a full point. If you pick 5, and you're going to lose 2 points, you get 1. So pick those that you know, don't over-select. Number 6, ABG. I know you know them. I know you have a strategy, but critical thinking question is not, I'm not asking you to tell me what is the ABG, because this is what nursing process and critical thinking, using the words together, know what you do as a nurse and figure it out. A client with the COPD, that's a buzzword. You got to pay attention. It's a COPD patient. What? He has a pH of 7.329, PCO2 of 58, bicarb of 24. What do you think? You got to make a diagnosis. What is your diagnosis? Look at the ABG and tell me what is the diagnosis. There's 4 possible choices. It can be a respiratory problem, or it can be metabolic. Is this a respiratory or metabolic? It should give you a clue. The patient is a COPD patient. Most likely, it's something you already know. Therefore, what do? Encourage per-sleeping, increase oxygen to 6 liters, prepare for intubation if respiratory fatigue worsens, teach about fluid restriction, monitor for lethargy and confusion, position client in the I-follow position. What do you think? Put down your answer. I'm giving you 30 seconds on this. But think about it. First, we got to make a diagnosis. What kind of ABG is this? What do you think is this ABG? And based on the ABG, you got to fix the problem, right? And so I always do ABG by looking at the pH. So what do you think the pH based on that and that? So what are your answers? Think about it. You have 6 possible answers. It's a select or apply. You don't have to pick all. If you pick all, you're not going to get all the answers, right? So pick those that you're confident. But let's work it through. 7.9, I know this is an acid, right? Acidosis. Who is responsible for the acidosis? Is it the CO2 or what? Bicarbonate. Bicarbonate is normal. Just by that, I've eliminated that. And I know bicarbonate is metabolic. Therefore, this is what? A respiratory problem. I have respiratory acidosis, which is consistent with COPD. Now, if I know this is respiratory acidosis, what would I do? That's all. It's a respiratory acidosis. How do you solve it? Get rid of the CO2. So you got to decrease the CO2. You got to blow it out. So it's a COPD patient. It's okay to per-sleep. That's good. This prolonged what? Aspiration, and will help with the process, right? Prolonged and getting rid of the CO2. If you think about 2, is a trap, right? It's a COPD patient. This is why it's called critical thinking nursing practice. You should know how to take care of a patient who has a COPD. A COPD patient, oxygen is bad for them. Increasing it to 6 liters will kill them. It will take their drive. Therefore, that is the wrong answer. This, you don't need oxygen, too much oxygen for this patient at this point is not good. So increasing to 6 liters is not a good thing. This is a trap. So don't do that. Prepare for intubation, yeah, if they get worse, right? Teach about fluid restriction. There's no fluid restriction. I'm not saying he has pulmonary embolism or anything like that. So this is no, or I'm not saying he has pulmonary edema. This is just respiratory acidosis. We need to get rid of it. So far it's wrong. Monitor for lethargy and confusion. Yeah, if they get sick because they can get overdose of the CO2, they become lethargic. Position the client in the I-follow position. These are your nursing process. These are steps you take. You implement, you evaluate, and then you figure out what it. Your implementation and critical thinking tells you, let them per-sleep, then prepare for intubation, monitor for lethargy and confusion, and then implement some strategy by pushing the patient in a high follow position. If you get a lot of them, congratulations. If you mix one, let's work on it. But these are critical thinking questions that are created this morning to help you out. But think about it before you answer the question. The buzzword is in the stem of the question. Don't rush. Just stay put. Figure out what you think you should expect before you look at the answer. If you jump on the answer, you'll be distracted. I don't like looking at answers before me knowing what I need to pick. Same thing. Which task can a licensed practitioner nurse safely perform? Delegation, assignments, you guys know it more than me, but I do it in a simple, straightforward way. Teaching a newly diagnosed diabetic how to administer insulin, perform monitoring for adverse effect of IV morphine in a post-op client, assessing a newly admitted client with a chest pain, developing a care plan for a patient post-MI. What do you think? 10 seconds. This is a delegation patient. You know what the LPN can do. Trust me, they can do a bunch of stuff. They can do a bunch of stuff, but I don't pay attention to that. I don't look at list, what they can do. I go by the simplified adjective. I go with the adjective and I call it MMR most. That is the easy way, right? With the M means monitoring, right? Another M, most medication, right? R, reinforcing things. O is the stomach, right? Special tests and a tube feed. That's all. It encompasses everything the LPN can do. Therefore, I see teaching. I never said teaching in this. The T is tube feed. I see monitoring, I'm picking it. I'm not even reading the rest of it. So far, I see monitoring, assessing, I'm out of it. It's not part of my nursing process for LPN. And developing is not part of it. Therefore, the best answer for this question is what? Monitoring for adverse effect is the key. This is Adapt NCLEX. If you join us, thank you for joining us. This is we working on what? Critical thinking using nursing process. A client with the liver cirrhosis as an NG tube draining green bar, right? Abdominal distension and rising ammonia level. Which intervention is the most important? This is the case. He has cirrhosis, he has obstruction, and he has rising ammonia. Something should trigger you that cirrhosis patient cannot clear the ammonium. So if the ammonium is high, they're going to have hepatic encephalopathy. This is the nursing process critical thinking question, high-level critical thinking. Based on what you know, rising ammonia is going to cause hepatic encephalopathy. What would you do in your nursing process, right? You have all the assessments, you have all the evaluation you've done. Do you want to do? What do you want to do? Do you increase oral protein to help healing? Do you irrigate the NG tube with sterile saline? Do you administer prescribed lactulose? Do you encourage ambulation to improve digestion? Use your nursing process. You've assessed the patient. You're collecting the data. You need to do some implementation. Which implementation is going to be effective with a good outcome? This is it, right? Straightforward. We are using it, critical thinking to answer questions using the nursing process. This is all you have. Ammonia level that is high will cause what? Hepatic encephalopathy. Therefore, I need to treat the ammonia before the patient develops hepatic encephalopathy. Which of these will treat the ammonia? That's all. What do you think? Lactulose is your right answer. Lactulose is going to get rid of the ammonia and deal with the problem. Increasing protein is going to worsen it. Irrigating the NG tube with sterile saline, it has nothing to do with the bar. It's not going to help you. Patient is what? He has NG tube, is distended, he has rising ammonia level. Why would you have to walk him? Don't walk him. It's no good. So that's bad. Prioritization, you know I like prioritization. You got to be sharp. And how do you be sharp? You worry about breathing issue, electrolyte, shock, sepsis, airway, and pain that is going to kill you, not pain that it's just regular pain, right? And you divide the question into two. You have done, you got to read it. This is the way I want you to read it. Next time you're doing prioritization, don't read it the way it was written. Just divide it into two and circle the buzzword. I have burned and now my pain is 8 out of 10. That's all. I have tracheostomy, and I have small amount of blood thin mucus. Should I expect that? I have C. diff, and I have had 5 bar movement. I have GBS, Guillain-Barré syndrome, and I'm reporting dysarthria. What do you think? What do you think? It's called B sharp. If you need what it means, just check Adapt NCLEX. I have a bunch of video where we talk about breathing, electrolyte shock, sepsis, airway pain, right? The burn patient has pain, right? Is this pain going to kill you? Is pain that will lose your limb, life, eyesight? I don't see that here. Tracheostomy, small amount of blood mucus. Is he having airway issue? Maybe, but he said it's a new tracheostomy, small. I expect some bleeding around the site, so it's not a problem. I have C. diff. I'm having a lot of diarrhea. Am I in shock or dehydrated? Of course, yes. But GBS dysarthria is an airway problem. Swallowing is an airway problem. Difficulty, dysphagia is an airway problem. Dysarthria, speech change is airway problem. So whenever you see these information regarding these neurological problems, forget about weakness, forget about everything. Pay attention to dysphagia, dysarthria, swallowing problem, and speech. Those are your priority. Therefore, I'm picking number 4 as my answer. And the last one, critical thinking and knowing your content as a nurse as you use the process, right? The client receiving vancomycin IV develop redness, flushing, and itching during the infusion. What is the priority nursing action? What would you do? Slow down the infusion rate, give them diphenhydramine, stop the infusion and notify the provider, document the reaction, and monitor vitals. What do you do? The last question. I give you 10 seconds. Think about it. Underline the buzzword. Go with the buzzword. Vancomycin. What has happened? I have redness, flushing, and itching during the infusion. What do? I know what it is. I know what this medication is. I know what these signs and symptoms are. Put it together. Don't get distracted. Don't get distracted and say, oh, something is happening. You know the content. NCLEX will do that to you. Nursing school will do that to you. See, they put all these things, say, oh, I got to do something bad. No. IV vancomycin, redness and flushing, and itchy is what? Redman syndrome. How do you treat Redman syndrome? Slow the thing down. If you call the doctor, you stop the infusion and call them and say, you know what it is. It's a Redman syndrome. It's not allergic. You're running it too fast. Why do you stop it? Why do you call me? Before you give them diphenhydramine, you have to slow the rate down, right? It's okay to document the reaction, but you got to fix the problem. Number 1 is the right answer. This is the best answer. Think about it, right? This is critical thinking. If you stop the infusion, you call the doctor and say, oh, you know what it is, right? This is not allergic reaction, Redman syndrome. Slow down the rate. So slow down the rate. The right answer is number 1. This is Adapt NCLEX. Thank you for watching. Thank you for your time. If you like this video, you can put a comment. If there's a question that trick you, just you can put a comment. I'll reply. But good luck and have a good day. Best of luck.